Hi everybody, it's Jenn from McCreath, Saturday, October 15th, 2022. Today we're going to talk about the Canada Health Act and how we have a problem when you have an act at a federal level of government that is implemented and enforced at the provincial level. The Canada Health Act says we have to have this great Canada healthcare system that is administered by the public system, that it's comprehensive, it's universal, it's portable, and accessible. Okay, great. Sounds great on paper. There it is. Let me show you. Canada Health Act. See? Public administration, comprehensive, universal, portable, and accessible. But there's only one problem. I'm going to balance this camera. What happens if you've got a province that's not adhering to this? Well, you phone the federal government and say, I have a concern. I don't think my province is implementing their healthcare system as per your act. And they told me, we don't care. We write the act, but we don't enforce it. Really? You're going to let the provinces interpret the act and administer their own healthcare without any oversight, without any audit or compliance checks? And they said, yeah, that's pretty much it. All right. So we've got this healthcare system in Newfoundland, Labrador. You may have noticed in the news that it's falling apart. Emergency rooms are closing for lengthy periods. Doctors are leaving Newfoundland. They're moving to other provinces, to other countries. They're retiring. They're changing professions. Things are so bad here. And I'm going to give you a perfect example. I live next door to a hospital. It's a 5-minute walk to the nearest MRI machine. But guess what? I can't use that MRI machine. You see, you need to have a referral from a specialist in order to get access to an MRI machine. No, my family doctor doesn't have authority, even though they know and I know that I have a torn ligament in my fucking leg, knee, whatever you want to call it. But no. I have to wait. I have to go on a waiting list. Stephen Harper. Do you remember him? Yeah. I try not to remember him, but he said access to a waiting list is not access to health care. And he was right about that. I'm on a waiting list. What's that going to do? Excuse me, I got to clean my nose out here. Oh, just getting over a cold. So I'm on this waiting list. This could be 6 months. It could be a year. That's not good enough. If you have a torn ligament and you don't get it fixed, guess what happens? You could be in serious trouble. You could have permanent, irreversible damage done. I'm feeling my knee right now. It's been almost a month. Soft tissue injuries that are minor will heal on their own. I get that. I can actually feel scar tissue where the ligament is torn. I got to get this thing fixed. That's a whole other question. Getting an MRI is just the first step to diagnosing the problem. Then I got to find a surgeon. But if I at least have an MRI that says I have a torn ligament, maybe it'll be easier to get through those gatekeepers and I can actually get the surgery done. That's my thinking. The other option, I can stick with our great Canadian solution here. I can sit here and sit on the waiting list. I can hobble around. I can barely walk. I'm taking taxis just to get to and from work. I'm walking when when you run out of money, that's a whole other issue. If I fall, I could slip and fall down the stairs this afternoon. I could twist my ankle climbing up one of these hills. What would otherwise be a minor ankle sprain could turn into a catastrophic problem for me. When you already have instability in your knee because of a torn ligament, you risk damaging other parts of your leg. And believe me, I've already done that twice. I've also loosened the PCL and the LCL ligaments in my knee, and I've also wrecked my ankle and my foot. And I really don't want to risk waiting, trying to survive a Newfoundland winter without a car. I'm literally walking up and down icy hills. I always fall on the ice at least once a year. Unfortunately, that's just the way it is. We don't clear our snow off the sidewalks here. that's a city issue, but they're incompetent. I won't get into that here in this video. You can go find my rants on that. Bottom line, I need an MRI. There's a machine right across the street, and I can't get access to it because of the Newfoundland healthcare system. So the only other option for me is to find a private clinic. But we can't have private healthcare. Well, yes, we can. And I'm damn sure happy it's out there. I went through the transgender process 15 years ago. And I know times have changed and it's getting a little easier to transition, but the private healthcare system helped me get through my trans process in a timely manner. Now it looks like I'm going to have to go to the private healthcare system for an MRI. But guess what? There's no private MRI clinics anywhere near me. The closest one is in Halifax, Nova Scotia, and they want $1,000 for an MRI. Well, no matter what, I'm going to have to buy a plane ticket. I can't walk, I can't swim. It's just too far away. I can't drive. I don't have a car. I'm not going to rent a car and buy all that gas because that's too expensive. I have pride in Canada. There's a sense of loyalty to this place, but something's extremely wrong when there's an MRI machine next door and I can't get access to it. And it's actually cheaper for me to fly to the United States of America. They don't charge $1,000 for MRIs. They charge it as low as $225 US. A plane ticket from here to Halifax is maybe $400. A plane ticket into the US is probably $600. I am actually looking at buying a plane ticket and flying literally from the most northeastern point of North America, ironically to the most southwestern part of continental US. The cheapest place in the United States to get an MRI is Los Angeles. That's about as far away from here as you can get without leaving the continent. But yes, if I want to get an MRI done in a timely manner, I have to fork out money that I don't have and buy a plane ticket, and I'm going to go to Los Angeles. It's either that or just wait here on this waiting list and hope that it doesn't get worse. I know I'm injured. I need surgery. I need to get this fixed. I'm going to have to do it. I'm risking bankruptcy. We all know I'm not well off financially. I'm not one to go begging for money, and I'm not going to do the GoFundMe thing because I just don't think that's right. I think we ought to take care of ourselves the best we can. I'm privileged to a certain extent. I know I'm trans, so I've faced discrimination. We all have ups and downs in life. I'm not going to beg someone else to pay my way. I'm going to do what I got to do to survive. If I have to be a martyr to the system, I will. But it just seems absolutely shameful and unfortunate that someone who lives in St. John's, Newfoundland has to fly to Los Angeles, California on their own dime to get an MRI done on their knee. But that's exactly what we're looking at right now. Even though we allegedly have this great healthcare system here in Canada, it's bullshit. It's a myth. Let's stop fooling ourselves. Newfoundland, Canada, specifically Newfoundlanders, look at yourself in the mirror. Do you honestly believe we have great healthcare here? Do you believe that our system is working? Don't fool yourselves. Things got so bad last year, or was it this year? Earlier this year. Our Premier took the Minister of Health, who's a doctor, and booted him out of health and moved him over to education. And then he brought the education minister into health. We now have a doctor running the school system and a teacher running our medical system. Does that make any sense either? What the hell's going on here? Why do we put up with this? We deserve better. We so deserve better. And we must do better. At least I can borrow $1,000 from the bank to go get this MRI. A lot of people don't even have a $1,000 loan available to them. I gotta get this knee fixed. I can't risk permanent injury. If I can't move, then I can't work. And if I can't work, I can't pay my bills. If I can't pay my bills, I have no food, I have no place to live, I'm out on the streets, and I'm probably gonna die. That's not the path forward for me. That's not good enough. Sitting on a waiting list, hoping I don't fall and hurt the knee anymore, that's not the best plan. Risk versus reward. We're going to go to the US, we're going to get this MRI, and we're hopefully going to find someone willing to operate on me and fix this fucking knee. No wonder people are leaving here. We got to do better than this. It's just unacceptable. Thanks for watching.